Hello and welcome. This is John Dombrowski, Dr. John Dombrowski of the Washington Pain Center on instructional videos on spine injections. Again, if you're watching this video, you probably have a prescription that says epidural on it. As mentioned in the first one, that is a generalized injection. That's what was traditionally done for many, many years. Classically, epidurals used to be done just by feel. The physician would feel the patient's back, place the needle in between the backbones, and inject the medications. That was a classic approach, or the other way of saying it is a blind approach. Nowadays, with most patients, senior physicians, physical medicine rehabilitation, or especially anesthesiologists, we're using fluoroscopic imagery. This is an X-ray guided injection. So it is a smart bomb. As we saw in the Iraqi war, you saw the warhead with the camera, and you could target the site specifically. That's exactly what fluoroscopy does for us. It does something for the patient too, in that it increases the success rate of injections, which you want as a patient, but also limits the amount of steroid one is given because the target is more specific. So the epidural injection is put right down the middle. We've got that. But the majority of the time when you see a as a pain medicine physician, is you're going to probably have low back pain that radiates down one leg. If that's the case, it's a classic herniated disc or degenerative disc disease, especially at that particular level. Now, instead of doing the epidural, which you probably have the prescription for, where we put the needle straight down the middle and the medicine goes both left and right-hand side, you probably want to be able to target that medication more to the affected side. And that's why it's called a nerve root block. So how would we do this? Again, similar spine. What we do is take the needle on the side, again, after we've cleaned the skin off sterilely, we've anesthetized the skin, you put the needle through the side, and then put the needle in the hole right here on the side, right where that nerve root is compressed, or as you have your symptoms. Then we inject the medications. This is, again, more targeted, probably more elegant injection, less medication to the patient. And again, you get the same benefit because it's more targeted. Again, benefits of this, again, is going to be more targeted relief. Again, 1 to 2 days, maybe leaving a bit sooner. Are there risks? Sure. Anytime you would put a needle anywhere, there's risk of bleeding and infection, worsening of pain, headache, nerve damage, reaction to medication. Again, all this is extremely low, but never zero. One point is when you're getting near the nerve root here, you might feel a zing down your affected leg. Again, that shows that the needle is brushing up against that nerve root, and especially as the medication goes in, you again might feel that same sensation down a leg. And again, this is very normal. It can be bothersome, but extremely normal. You traditionally don't see that with the epidural injection, since there's no nerve root to really inject. This is more targeted and more elegant. Enjoy. Thank you.